Join us as we once again dive into that deep, dark pit of consumer misunderstanding known as Medicare and Medicaid, or how to be completely confused by your government while at the same time knowing you're being bamboozled more than half the time by numbers and procedures you are not, as mere mortals, meant to understand. Means we welcome back the Newsmax deputy health editor, co-author of the DaVinci Baby Boomer Survival Guide. Nick Tate joins us here. It's time to go ahead and survive Medicare and Medicaid.
Let's do that.
It makes people's heads, I think, explode every time they think about it. But I think we need to start with the fact that Obamacare is what we talk about a lot here, and a lot of the problems that it does not address these two issues, and these affect everybody.
That's right. Medicare is the program for seniors, for health care for seniors, and for disabled folks. Medicaid is the program for the poor. Obamacare does virtually nothing in the $1 trillion of spending over a decade to reform the health care system, to come up with a long-term funding scheme for Medicare, with the growing number of Americans that are turning 65 and qualifying, 10,000 a day, or really to deal long-term with Medicaid. They're putting it back on the states in some ways and merely mandating an expansion of coverage. So what we have is we have a fight happening in Congress now to fund the doctors who treat patients on Medicare. If they don't work out a fix in the next couple weeks, doctors are going to see their reimbursement rate go down by 22%, which is an enormous cut for doctors and provides a tremendous disincentive for many to drop their coverage for seniors. And we're looking at local fights like in Florida and other states on Medicaid as well.
Was there any specific hint, whatever, when Obamacare was in its early stages, that we might get to this point where the doctors were going to be hit so hard?
Yes. Every year for the past however many years, 10 years, they fix this problem piecemeal year to year. They do a year-to-year fix, and rather than coming up with a long-term solution which would save money in the long term and provide better care and make doctors know that they have a continuing source of income for treating these patients, we fix it year to year, and by some estimates that's cost the nation about $200 billion more in about the last decade than we would have otherwise spent. So it's a problem we need to fix. The other complication here is that Obamacare actually calls for cuts in Medicare over a decade of about $716 billion, just as the number of Americans qualifying is going up. So we really have a kind of train wreck heading our way that we're only fixing with Band-Aids and not a long-term solution.
Here's the downside now. You said we're on the way to the train wreck, and knowing full well that we're still fighting Obamacare and all the problems that are there. Mm-hmm. Is this train wreck fixable before we get to the point where it hits the end and we can't stop it and we're shot?
I think the answer is yes, theoretically, but given the practical reality of the way Congress has been working and this White House has been working, the answer is probably, it's a slim chance that it's going to happen. We don't really seem to do anything these days until we get to a crisis point, but I think we are at the crisis point. The big picture for seniors is they're going to be facing higher costs, probably either way, whatever fix is made, and many doctors are just saying, you know what? I want to get out of this business. It's not worth it to me. I'm losing money for every patient that I treat on Medicare. And for those doctors who want to help their patients, particularly seniors who have those needs, puts them in a really difficult spot, whether they can financially afford to do that or not.
What does the expansion of Medicaid mean in Florida?
In Florida, what's interesting, Florida is one of the states that initially said they were not going to buy into the prescribed Medicaid expansion that the Obamacare law requires, basically raising eligibility guidelines so more people qualify for the program for the poor. Many states that initially said, no, we don't want any part of it, are starting to jump in and say, well, you know, there's a lot of money here from the feds that we can take advantage of and fix these problems and care for our people. And Florida is one of those states. The state house and the governor, who initially opposed Medicaid expansion, are now turning their attentions to a way to expand Medicaid, but in their own terms. So, for instance, in Florida, they would like to take the money, if the federal government will give it to the state, and change Medicaid to make it more privatized, to work toward using Medicaid HMOs, which makes sense. They save money, they provide good care. The law that the House has passed, and we're waiting to see if the Senate will approve it, would also put a little bit of a copay on those insurance recipients, so they pay a little bit, and it would require them to both work or look for a job, so that it's not just health care without a connection. These are, I think, the models for a proposed compromise that the White House could potentially get behind that would allow for the expansion of Medicaid, cover people in the states, but also appeal to conservatives who are looking for the program to be financially sound and require a little bit of initiative on those folks who are taking advantage of government largesse. But will it happen? politics will answer that question.
I hate to say this, but people 60 and over are screwed. And that's really what it's beginning to sound like here. And unfortunately, they're being left out there in the cold, which is something that we'll talk about at another time, unfortunately. I want to remind everybody that the DaVinci Baby Boomer Survival Guide, co-authored by Mr. Tate, sitting right here. Make sure you get your copy at babyboomers711.com. Get that book right now. All right. Thanks for joining us, partner. Talk to you again real soon. When we come back, it is time to look ahead, if you will, but then look deep into the eyes of the water cooler. That and so much more, and the political punching bag later.